Good afternoon, everyone. This afternoon, we are going to talk about doctors' social responsibility. What doctors should do and what doctors have been doing. Excuse me. If they realize their responsibility, then definitely they are definitely going to do the right thing. Though they are doing, I'm not saying that they are doing wrong thing, but they are doing some not fantastic things. Little, sometimes they do something unethical if it is not illegal. For example, medical expenses are so high, medicine, price of the medicines are so high, doctors' fees are too high, and most of the poor people, and India is the nation of poor people, just cannot afford neither doctor's fee nor medications, surgery. For example, little bone is broken, surgery can cost you about 25, 30, 50,000. If you have a little cataract problem, it can run into about 50,000. That's my personal experience I'm talking about. If you have a little retina problem, it runs into about 50,000. Now, thing, General Hospital does not have retina facilities or cataract facilities. Now, where the poor person can go? So many things happens in the body. But if you think about public hospitals, general hospitals, that the person can go over there and get treatment. No, you have a misconception about that. General hospitals don't have a treatment of every single thing. Every surgical procedure is not performed over there. There are very limited number of beds are there. So now if you prefer to go to the private, then you know that still COVID has not left us. Just a couple of years back, COVID treatment would cost you 20,000 per day. That is the minimum I'm saying. General hospitals will tell you we don't have any seat. COVID did not kill 70 lakh people. But very high expense of getting treatment caused this many deaths. No seats, no beds available in the hospital. Caused no access to any kind of medical facilities to most very, very poor, down-the-earth, absolutely underbelly patient. They did not have access, that's why they died. I would say about 60 to 70% people who died by COVID, they did not die because of COVID itself. But because they did not have access, either because general hospitals did not have, beds available, or these patients did not have ample amount of money to spend on the private treatment. I know private treatment could cost around 1.5 to 5 lakh rupees. Now think, India is not the nation like Saudi Arabia or Dubai or Qatar or Abu Dhabi or Doha, or not in a Western nation where insurance is there, people are rich, they can have availability of every single thing, they can access all kinds of medical facility domestically or internationally. So now, doctors' social responsibility. Point number one is targeting all the epidemic, endemic, and pandemics. Doctor should not be confined in his four walls of the hospital, and whoever walks in his cabin is treated. But doctors actually approach, doctors reach, should go beyond those four walls and see into the society what epidemic, endemic, and pandemics have been going on and do something about them collectively in unison, all the doctors. All the entire medical community, entire medical fraternity should consolidate themselves, solidify themselves, and target not micro but macro medical problems. Go outside of your hospital. Don't treat only the patient who comes to you. But you go out and try to combat epidemic, local epidemic, or local endemic or global pandemic. That is doctor's responsibility to wipe out all kinds of maladies, all kinds of disease and affliction, not from the patient or patient's body, but wipe out from the global body. Number 2, affordable health care for all. Medical fraternity can actually decide this thing and achieve this thing, make it possible that every single person living in the nation, living on this planet, should have access to affordable health care. That is everyone's entitlement. That is everyone's right. It's a right to have affordable health care. Nobody should be denied. Now, the government can make the law over there in Delhi, and the person suffers over there, somewhere in the deep of, Saurashtra, and if he cannot afford, he is not going to file a lawsuit and go fight against that medical system or doctor or medical fraternity in the court. Or he is not going to go run all the way to Delhi and meet Mr. Modi and tell him that, Mr. Modi, you said that affordable health care is everyone's right, but I live over there in a small teeny-weeny Minneapolis teeny-weeny village where healthcare is not affordable. He's not going to do that. Doctors know that. Entire fraternity knows that people are not going to take any kind of action. They are not going to make anything possible. So they are not worried. They have been charging whatever their whims and fancy actually lead them to charge. Cataract surgery in the city of Junagadh cost about 50,000 rupees per eye. Now think about it. How many people have 50,000 rupees to spend on one eye? Think about all the people living in the ghettos and living in the Dharar Nagars and living in the very dirty, underdeveloped areas of Sukla Chowk and Dharagarh Road and Pisoriwala and all that. Government doesn't think about everyone. Government thinks about those who are prolific, who are creative, who are viable, who can pay taxes. Point number 3, construe not a profession, but philanthropy. Doctors must not construe, must not interpret, must not think that medical profession is a profession, it's a business. No, it is not a business, it's a philanthropy. Philanthropy means you are actually serving the society with whatever the knowledge God has bestowed upon you, and the nation has actually prepared you to be a doctor, spending millions on you. Now it is time to plow back. You should go for blowback. Government has actually plow in and made you a doctor. Now you plow back into society and make the society healthy. Make the society healthy, not a patient who comes to you, pays you 500 rupees for 5 minutes. You check and prescribe the medicine. And that chemist is going to milk him for more 1,500 to 2,000 rupees. Now that is not the purpose of creating doctors in the society. Purpose of the doctors of creating society is the doctors who actually take the oath of Hippocrates. Should know Hippocrates. Hippocrates never ever charge even a penny, even a red penny to his patient. That kind of philanthropy is medicine. Number 4, care not the patient, but care the society. You don't care the patient, you don't count the head of the patient, how many patients you have treated and how many patients have become cured and recovered by your medical, golden touch or by your medical touch. Yeah, we know. That you have Midas touch. But don't be happy by curing one patient. But your responsibility is to cure the society. Nobody in the society where you practice your medical knowledge given to you by the government, by your nation, by your motherland has given you that knowledge. That knowledge must be ubiquitous. That knowledge must be treating everyone in a carpet manner, in a level playing field. Everyone, not only the people living into the posh area, should be treated by your Midas touch, but the people who are living in absolutely dilapidated areas should also be getting benefit of your Midas touch. This is not for alpha only, but it's for epsilon and delta as well. So when everybody is getting medical facilities, everyone has access to medical relief and medical treatment, everybody has a right to live healthy life, and everybody has a right to get every single thing that he needs to survive without having to worry about any kind of money or any kind of resources or any kind of excess. That is what the doctor's social responsibility means. Doctor is not for a patient, but doctor is for all the patients, all the society, regardless whether the patient can afford doctor's fee or he doesn't afford. Doesn't matter. I do it. I do this. I'm a tutor. I'm not a millionaire or a billionaire. But when my student comes to me, I always ask, what your father does. And if he says my father is a rickshaw puller or a laborer or this or that, I say, look, my fee for 4 months is 4,000. But whatever your father can afford, you send it and I'm not going to count it and I'm going to take it home. Don't worry about it and I'm never going to have a discussion about it. A little philanthropy can make you feel good. Little philanthropy makes you happy, makes you satisfied, makes you sleep better at night. Think about yourself, you think about everyone and you pass your comments about everyone that he is like this and she is like that and he is like that and she is like that. Sometimes you pass comment about yourself, what kind of person you are. You yourself are. Sometimes think about it and it makes you realize. It will make you realize what you are and what you should be. Thank you very much for listening. That's all the time we have. See you again next time. Until then, God bless everyone on this planet. Amen.